Have you ever looked in the mirror and noticed your tongue looking unusually red? While it might seem alarming, a red tongue can indicate several things. In this video, we'll dive into the common causes of a red tongue, ways to treat it, and tips to prevent it from happening in the future. Let's get started. One common cause of a red tongue could be a deficiency in important vitamins, such as B12 or iron. If you're not getting enough of these nutrients, your tongue may become smooth and red. A simple blood test can help identify these deficiencies. Geographic tongue is another condition where your tongue may appear red in certain areas, often with a map-like pattern. Although the appearance is unusual, it's typically harmless and doesn't require treatment. Sometimes a red tongue can signal an infection like scarlet fever, which is caused by the same bacteria responsible for strep throat. This often results in a bright red strawberry tongue along with a fever and rash. If you notice these symptoms, it's essential to consult a doctor. Redness can also occur due to allergic reactions or irritants such as certain foods, toothpaste, or medications. If you've recently tried something new and your tongue turned red, it might be your body's way of reacting. Oral thrush, caused by an overgrowth of yeast in the mouth, can cause redness and discomfort on your tongue. It's more common in people with weakened immune systems or those using antibiotics for extended periods. Dehydration or a fever can also affect the appearance of your tongue. When your body's fluids are low or you're running a fever, your tongue might appear redder than usual. Kawasaki disease, a rare but serious condition that predominantly affects children. Kawasaki disease can cause a red, swollen tongue. If your child exhibits symptoms like a persistent fever, swollen lymph nodes, or red eyes in addition to a red tongue, seek medical help immediately. While less common, a lack of vitamin B3, also known as niacin, can cause glossitis, a swollen red tongue. This condition is often accompanied by other symptoms like diarrhea, skin issues, or confusion. A balanced diet or supplementation can help address this deficiency. Tobacco use, whether smoked or chewed, can irritate the tongue, leading to redness and inflammation. If you're a smoker, this might be a good time to consider quitting, not just for your tongue but for your overall health. Rare causes. Erythroplakia. Though rare, erythroplakia is a condition that causes red patches on the tongue which may indicate precancerous changes. If you notice persistent red patches that don't heal, consult a specialist immediately. Autoimmune disorders. Conditions like Sjogren's syndrome or lupus can sometimes cause redness or inflammation in the mouth, including the tongue. These disorders often come with other symptoms such as dry mouth, joint pain, or fatigue. Glossitis. Glossitis refers to inflammation of the tongue, which can make it appear red, swollen, and painful. It can be caused by infections, burns, or irritants and might require medical treatment depending on the cause. Treatments. To treat vitamin deficiencies, try adding more vitamin B12 and iron-rich foods to your diet, such as leafy greens, eggs, and meat. If necessary, consult with a doctor about taking supplements. For fungal infections like oral thrush, saltwater rinses or antiseptic mouthwashes can help soothe and clean your tongue. Don't forget to maintain a regular oral hygiene routine, brushing your tongue gently to remove bacteria. To prevent dehydration, make sure you're drinking enough water throughout the day. Staying hydrated supports your overall health and keeps your tongue looking healthy. If your red tongue is caused by an infection like scarlet fever or oral thrush, it's important to seek medical treatment. A doctor will prescribe the appropriate antibiotics or antifungal medications. Maintaining a healthy diet rich in vitamins, especially B12 and iron, can help prevent deficiencies that may cause a red tongue. Prevention tips. Regular oral hygiene is key. Brush your tongue gently and use mouthwash to reduce bacteria and keep your mouth fresh. Remember to stay hydrated. Drinking enough water can keep your tongue and body healthy. Keep track of potential food allergies or sensitivities, and avoid products that may irritate your tongue. Now you know the possible causes of a red tongue, how to treat it, and how to prevent it in the future. If your symptoms persist or you're unsure about the cause, always consult a healthcare professional. If you found this video helpful, don't forget to like, share, and subscribe for more health tips.